the most significant healthcare crisis in modern times. COVID-19 has devastated the world and has deeply impacted us all. Overwhelmed with critically ill and injured patients, critical care professionals provided comprehensive treatment despite shortages of PPE and therapeutic agents. In crowded units, the number of patients vastly exceeded the numbers of clinicians. Many of our colleagues became patients. Because of the generosity of donors just like you, SCCM was able to rapidly develop and deploy key resources to units and facilities in dire need. With your donations, the global critical care community pursued innovation and collaboration to meet patient surge. For me, this pandemic has been a testament to courage, humility, and humanity, all while driving us not only to do more, but to also do better. I'd like to share what SCCM has accomplished and what it continues to pursue to assist the critical care community during disasters and emergencies. SCCM led COVID-19 critical care support, education, and inquiry in 6 key ways. First, our resources helped train more than 500,000, you heard that correctly, nearly 500,000 non-ICU clinicians to work as members of teams led by critical care professionals to meet surge. Second, SCCM developed a COVID-19 Rapid Resource Center. This provides clinicians free articles, presentations, recorded webcasts, and micro-learning presentations, all focused on COVID care. Third, we established a first-of-its-kind COVID-19 registry, aptly named VIRUS. This stands for Viral Infection and Respiratory Illness Universal Study. VIRUS evaluates the safety and observational effectiveness of COVID-19 practices. Fourth, our COVID-19 What's Next conference reinforced collaboration by bringing together experts from 14 supporting societies and featured the latest research findings, guideline updates, and forecasts for the future. Fifth, we sent close to 1,000 volunteers, you may have been one of them, to COVID-19 hotspots to help support under-resourced ICU staff or to staff ICUs that had no clinicians at all. And finally, SCCM partnered with the humanitarian aid organization Direct Relief. Together, we brought supplies, equipment, and therapeutic agents to clinicians and patients around the world. For example, resources were sent to more than 45 hospitals in devastated COVID-19 hotspots in the U.S. alone. Most recently, SCCM helped coordinate the delivery of more than 10,000 oxygen concentrators to Brazil and India. And yet, our work is not done. SCCM had not budgeted for any of these resources. Instead, we responded to the crisis as part of our vision. It was past President Peter Safar who foresaw that SCCM's members would indeed be world citizens. It is that vision that drives SCCM today. The Society is incredibly grateful to the generous in-kind and financial donations from members, as well as corporate and foundation partners alike. None of our global disaster responses would have been possible without you. Well done. But we must now prepare for what is yet to come. It is my privilege to invite you to join me and the thousands of other members who support SCCM's ability to enable critical care around the world. Please consider donating at sccm.org/donate. On behalf of everyone at SCCM, thank you for your dedication to critical care medicine, your patients, and each other.